This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is adenosine deaminase deficiency? Answer: Adenosine deaminase deficiency is a condition in which there is a decrease in the activity of the ADA enzyme. Question: What is the function of ADA? Answer: The function of ADA is to degrade adenosine and deoxyadenosine. Question: What happens when there is a decrease in ADA activity? Answer: When there is a decrease in ADA activity, there is an increase in DAT, which leads to a decrease in ribonucleotide reductase activity and a decrease in DNA precursors in cells, ultimately resulting in a decrease in lymphocytes. Question: What is one of the major causes of autosomal recessive SCID? Answer: Adenosine deaminase deficiency is one of the major causes of autosomal recessive SCID. Question: How does a decrease in ribonucleotide reductase activity affect DNA precursors in cells? Answer: A decrease in ribonucleotide reductase activity leads to a decrease in the amount of DNA precursors in cells. Question: How does a decrease in DNA precursors in cells affect lymphocytes? Answer: A decrease in DNA precursors in cells leads to a decrease in the number of lymphocytes. Question: What is autosomal recessive SCID? Answer: Autosomal recessive SCID is a genetic disorder characterized by the inability of the body to fight off infections due to a malfunction in the immune system. Question: Is adenosine deaminase deficiency the only cause of autosomal recessive SCID? Answer: No, adenosine deaminase deficiency is one of the several causes of autosomal recessive SCID. Question: What are the symptoms of ADA deficiency? Answer: Symptoms of ADA deficiency can include recurrent infections, slow growth, and development delays. In severe cases, it can also lead to the development of cancers. Question: How is ADA deficiency diagnosed? Answer: ADA deficiency is diagnosed through a blood test that measures the level of the enzyme in the blood. Question: How is ADA deficiency treated? Answer: Treatment for ADA deficiency typically includes enzyme replacement therapy, in which the missing enzyme is replaced through regular injections. Bone marrow transplantation is also a treatment option for some patients. Question: Can ADA deficiency be prevented? Answer: ADA deficiency is a genetic disorder and as such it is not preventable, but early diagnosis and treatment can help to prevent complications and prolong life. Question: Is there a cure for ADA deficiency? Answer: Currently, there is no cure for ADA deficiency, but with treatment and management, patients can lead a relatively normal life.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.